Hello, everyone, and thank you so much for joining us. This is Georgie Carter from the Health Policy Plus project. I'm delighted to welcome you to today's watch party and panel discussion centered around the video Messages of Hope, Reaching Boys and Men with HIV and AIDS Information. We have a great broadcast for you today, and we'll begin with just a few announcements. This session is being recorded, and we will post the recording to the HP Plus webinars page. Now, we would love to hear from you, and we welcome your questions at any time. So please submit the questions via the chat box on the right side of your screen or at the bottom of your screen if you're on a mobile device, and our moderator will read them aloud when we pause for questions. Now, these web conferencing platforms are getting a high amount of traffic these days, so we just ask that you bear with us in case there are any glitches with the technology. And finally, we ask that if you're not speaking, please mute yourself just to keep the line nice and quiet while others are talking. So that concludes our announcements portion, and it's my pleasure to hand it over to my colleague, Ashley Gibbs, Technical Advisor for HP+. Ashley?
Hi, good afternoon, good morning, everyone. My name is Ashley Gibbs. I'm a Technical Advisor with HP+, based in Washington, D.C., and it's my pleasure to be your moderator for today's video watch party and panel discussion about the Faith and Community Initiative in Malawi. So on this screen, you can see our agenda for today. We're going to begin with opening remarks from Eric Malanga of USAID Malawi. Then we'll play the video, Messages of Hope, Reaching Men and Boys with HIV and AIDS Information. Following the video, we'll have a panel discussion and you will have opportunity to ask questions. Please type your questions in the chat box on your screen and I will read them aloud to the panelists. And then finally, we'll end with closing remarks from HP Plus Country Director Olive Ntema. Next slide, please. So it's my pleasure to introduce our panelists for today. Tioni Chilambe is the head of coordination and capacity building at Malawi's National AIDS Commission. Dr. Stan Zinkanda is the director of health and social services at Chikwawa District Hospital. Howard Kasia is the Health Commission Manager of the Evangelical Association of Malawi. Zaiti Jambo is the Executive Director of the Quadria Muslim Association of Malawi. And Eric Malanga, Branch Chief HIV Prevention of USAID Malawi, is now going to provide some opening remarks. Eric, over to you.
Thanks, Ashley. Good morning and good afternoon, everyone. Thanks HP Plus for organizing this webinar. I think it is very timely as we reflect on the work done by HP Plus and how we can carry forward some of the lessons through the faith and community activities here in Malawi. According to UNAIDS, faith-based organizations share of the health activities in Malawi is 37%, and 96% of the population is either Christians or Muslims. So there's a big potential for impact to engage in faith community to implement PEPFAR activities. Looking back, we have every reason to celebrate what you have been able to achieve through HP Plus in implementing the faith and community activities. FCA had two main objectives. The first one was to engage faith communities to understand the epidemic, to raise community awareness, and bring critical prevention and treatment interventions with a goal of increasing the proportion of men and children living with HIV who know their HIV status, are linked into care, and have viral load suppressions. The second objective was to strengthen justice for children through preventing sexual violence, targeting the 9 to 14 years old, girls and boys through integration of faith leaders, traditional leaders, and other community leaders in the faith-based organizations. So today we are going to hear from various speakers how these objectives were met and some of the lessons learned that we can sustain through ongoing activities. Thank you very much. Over to you, back to you, Ashley.
Thank you so much, Eric. So next, we're going to screen our video, Messages of Hope, Reaching Boys and Men with HIV and AIDS Information. HP Plus created this video because the Faith and Community Initiative, or FCI, has produced some truly exciting results, and we really want to share this experience with others in Malawi and beyond, in hopes this approach can be expanded and also replicated elsewhere. FCI was a true collaborative effort with 6 religious mother bodies, hundreds of religious leaders, peer champions, expert clients, the government of Malawi at all levels, and of course, communities all across the country. So in this video, we hope you'll hear in their own words from just a few of the many individuals who made FCI possible. I hope you enjoy the video. Great. I hope everyone enjoyed that video. It is posted on the HP Plus website and YouTube channel if you would like to watch it again later or share it. But for now, let's turn to our panelists. So I'll invite our panelists to come on camera if they're able so everyone can see them. Please, audience, type your questions into the chat box on your screen, and we'll go through them and I'll read them to the panelists. To get us started though, I have a few questions to kick us off. So my first one is for Ms. Tioni Chalambe from NAC. So we know that NAC provided coordination for the Faith and Community Initiative across Malawi and also supported alignment of the program with Malawi's National Strategic Plan. So can you talk a little bit about how the Faith and Community Initiative aligned with government priorities for the national HIV response?
Thank you very much for this opportunity to give feedback and actually the experience NAC had working with this program. NAC is the national coordinator for the response of HIV in Malawi, and as such, the quote unquote, since we are talking about faith, the Bible, the Quran, that sort of guides our HIV dogma is the National AIDS strategic plan. And in the current strategic plan, we identified men and boys as populations that are left behind. Malawi is doing very well in achieving the 1990 targets and the 1995 targets as we push towards eradicating HIV as a public health problem by the year 2030. But the challenge that we're having is there are some populations that are being left behind, and these are men and boys. So this particular project spoke directly to that and ensured that we are able to make some strides in that particular subpopulation. So number one, it is in alignment with the National Strategic Plan. Secondly, I want to say that as a country, Malawi is a faith-based country, and as the video rightly put, if you want a shortcut to reach 100% of Malawians, go through the faith initiatives, because every Malawian, be it, subscribes to one version or the other of religion and faith. So if you are planning on making sure that you reach out to every single Malawian, going through the faith sector is the simplest of them all. And what happened is that this is not the first time we've done this. When we're doing major rollout of testing, community mobilization, adherence and treatment and all that in the late 90s and early 2000s, the faith sector played a major role. We have a program that we did that was working with families on mutual faithfulness as part of our prevention efforts. And for that particular program, I want to tell you that program, I think NAC stopped funding it, though the cycle for the funding ended around 2014, but the materials that we did with that particular program, they're still being used in those churches. And why am I using this as an example? I want to impress on HP Plus and USID that when you invest in the faith sector, it's a sector that's going to be there whether HIV exists or not. And as a result, in terms of investment case, this is the best bang for your buck, if I'm to ever put it that way. That the dollar that you put in here will give you dividends long after the actual tangible investments are gone, because it's inculcated in the dogma and in the teachings of the church. So for that reason, we say it's a good whatever. And also what I liked about this particular program is, much as NAC is the national coordinator at a higher level, we have a sub-sector coordinator, which is MIA. MIA is the Malawi Interfaith AIDS Association, and this sort of oversees all the mother bodies and ensures that the HIV information is incorporated in everything they're doing. And MIA was also involved in this particular program. And once you involve MIA, you involve NAC, and you involve all the mother bodies, let's be assured that whatever investments you've made will live beyond the program. So for this one, it was a good investment. Would like to see more of it. And I think next time when we do it, as NAC would like also to think through, because I'm hoping that there's going to be a chance to do a continuation. It was a bit short. One of the things we'd like to do is do good material development that sort of reviews the current material that the church already has and sort of mainstream the information, because nowadays we're looking at mainstreaming information. So it should be a little bit more mainstreaming focused to make sure that it doesn't look like it's a project or something foreign that we're doing. It will just be embedded in whatever the church already does for long-term sustainability. I think let me stop there. Thank you.
Thank you so much. So my next question is from Mr. Saiti Jambo of Qu'ran to talk about what this looked like to integrate messages of hope into a faith community. So in the video, we saw some great examples of Muslim leaders using the messages of hope in different settings. So my question for you is, how did Muslim communities receive these messages, and what strategies did Qu'ran use to integrate the messages throughout your structures?
Well, good afternoon. As a Qu'ran, the first thing was to use the information gap that was there. With the HP Plus, I think there was NAC. We went into the village and then he did some sort of research, and then he found that maybe these people need some information that will be the Islamic teachings. So we came back and then developed the messages together with the sheikhs, and that incorporation of Islamic teachings into the messages, I think, played a greater role so that the faith readers accepted the materials as their own, not as something that has been just imposed on them. So when we went to the village and we did some the booklet, I think what we saw from the religious leaders was that they were easily adapted and they could use the messages in their own settings. So the first thing was knowledge empowerment. So we gave them the knowledge on the materials. And then the second was how they can mainstream that booklet into their religious settings. So it was like the Friday assembly prayers, that's the sermons. And then when we went back, we now designed a practice or a methodology where we said, okay, we're teaching every Jim and Jack in the mosque, in the what, but the young people are not coming maybe to the mosque in large numbers. Where can we get them using the same Islamic approach? So this is where we used the competition and football bonanzas. But the zikri one was now taking messages from the booklet into their form of practices whenever Muslims are having various gatherings. So they use the zikri to entertain people. So we said, why can't we use the same zikri to incorporate HIV messages? So we taught the muftis from the project areas and then incorporate the messages into their zikr. So it was really accepted from all the angles, the big sheikhs, the local imams, they all accepted and they participated in the program. Hello?
Yes, thank you so much for explaining that. It sounds like it was really integrated into what you were already doing to reach the people. So I'm going to move on to the next question. This one is for Howard Kasia from the Evangelical Association of Malawi. So I know EAM did a lot of different activities under FCI, but I wanted to ask about support for treatment adherence for people living in HIV. And specifically in the video, we heard that some religious leaders in Malawi had been discouraging people from taking their ART, which is a harmful practice, and some people had stopped treatment. And so one of FCI's priorities was working on this. So what approaches did EAM use to address this and support people living with HIV to stay on treatment?
Thank you so much for joining this sharing. And thanks for the donors and Palladium for the project, which has helped a lot of people to come back to treatment, but also to be open enough to accessing HIV and AIDS services. I think the first thing is to admit and acknowledge that faith, prayers, and some religious practices have been some of the factors that have attributed to defaulting from treatment, but even not wanting to access HIV and AIDS treatment and other services, believing that the prayers and religious faith practices is going to be the answer in everything. And therefore, Evangelical Association of Malawi, through this FCI project, we had three approaches that we used to ensure that we are making the religious leaders and the pastors encouraging people that are on treatment, that have been tested and that need to be tested, to encourage them that they can access these services. And these three, the first was to ensure and train our pastors, knowing that health is a universal right. So all other things that are required to make sure that the people are healthy needed to be accepted and practiced. And out of that, we did develop a policy that was explaining some programs and approaches, and that pastors needed to be involved to ensure that people are testing, accessing treatment, but also they are adhering to treatment. The second was to look at the issues of knowledge on the issue of HIV infection and AIDS. And in this case, the booklet on the messages of hope was very paramount in discussing issues of HIV infection and AIDS, the basic facts, and even some of the scientific needed information to the pastors and the religious leaders. And the last way was to do consultation and dialogues with the religious leaders. So instead of putting them off, EAM and the rest of the faith-based organizations that participated in this project were able to bring the religious leaders together and the reason together through various information and the required basic issues on HIV infection and AIDS. And with that dialogue, we're able to be arriving at an agreement on what should be happening by pastors and religious leaders. And one of the things that we has been agreed in all these dialogues was that whilst we are able to be praying for patients, giving them hope, we should not be stopping them from taking ARVs or from accessing any other HIV and AIDS testing, because that was very important and very good for their health. These three, and in the addressing of the issue of faith healing affecting access to HIV and AIDS services, has helped a number of people in and a number of congregants in churches, in communities. Number one, to accessing HIV services, including testing, and number two, accessing the treatment with an open mind, as Jambo I think said, and one participant was testifying, the issue of stigma was completely dealt with. And lastly, to ensure, and it ensured that people that are on treatment remain in treatment, and those that had defaulted, we had made a big stride through this project, that a number of them came back into treatment and continued and adhering to this to the treatment. So the project, through accessing and facing the issue of faith healing, has had a very big impact in bringing back people to treatment, but also being open to accessing HIV and AIDS services. Thank you so much.
Thank you, Howard. So the next question is for Dr. Stalin Zinkanda. So Dr. Zinkanda, in the video, we heard you speaking about the FCI program and the impact it had on HIV service uptake in your district. So I was wondering, could you speak about the collaboration you saw between religious leaders and health facilities? And what did this look like, and what helped make this successful?
All right. So thank you so much for the question. The first part I would say is that we cannot overemphasize the power or the influence that the faith bodies have in the population, in the all the populations in the country. Um, so in terms of the issues of the collaboration that was there, I think the first thing is that we rode on the understanding that people do believe, do trust the religious leaders more than they would even trust the health workers. So the approach that the project had, starting with our all the governance structures from the management point of view, getting through the governance structures in the district, and then now going down to the specific areas. I think the collaboration is quite okay, and also I think because the ones who were leading in the project as well also had a very good footing with the people on the ground. I think that really indeed helped that. The outcome should be better. Giving an example, I think I would say that we at around 2018, I think we had one area where there was one lady who was calling herself as a prophet, but she was telling people not to go to the hospital. So we had a couple of dates, even HIV related and others not even HIV related. So when the project came in, one of the targeted areas was that particular area. And when that was done, there was a proper mutual understanding between the prophetess as well as the ones who were handling the project and our office, and the cases of people defaulting really went down. But also, I think to add more on the issues on issues of the collaboration that might also be considered as we move forward is to continue using the existing relationship between the government and the religious bodies. For example, we've got the Christian Health Association of Malawi. They are also quite key because they provide about 29%. They have the number of health facilities that are in the country. About 30% of them sort of belong to Christian Health Association of Malawi, as well as also partly the Islamic Health Association of Malawi. So that already existing relationship, if you were to invest more in that particular relationship, so that because when the people are getting the access and these are facilities belonging to the religious bodies, I think people would get the messages more and better. I think the other way that we would also want to look at in terms of the integration is also, almost all the districts there and the different religious bodies do have what they call chaplains. Most of the times they are specific to a hospital, but the church might also be able to say, okay, can we also go out into the community that even as we teach the people, we encourage the people in the hospital, but also we can even go to the communities. So I think if we were to work much on these areas, I think we should be able to see more improvement to sustain the achievements that we've gathered so far. I think just to hear one area, I think just one area that we might also want to focus much on is most on the Christian point of view. I think the coming up of different teaching, that there have been some sort of different teachings or interpretation of the Bible. So if we also mostly to calling messages that are specifically targeting those teachings that have really been coming up saying people shouldn't take the medication because they've been prayed for. So focusing on that area, I'm sure I should be able to get more gains as we go along. But otherwise, overall, I think the project is okay. We really request that we have it comes again, and we involve all the religious bodies in the district. That way, I think we should be able to reach as many people as possible. Thank you.
Thank you so much. I'll move on to the next question we got through the chat. And just a reminder to our audience, please type your questions in on the right-hand side of your screen and I'll read them to panelists. So the next question is for both Howard and Saiti. So the video mentioned the collaboration of the religious mother bodies with one another and working across religions. And this seems valuable, but maybe unusual to have so many different Christian and also Muslim groups working together. So could you share what your experience was like working across religious denominations to address the challenge of HIV?
Thank you very much. I think at the beginning, Chirambe explained the role of FBOs in the NAC or the NAF, National AIDS Strategic Framework. I think it has not been a problem to us because we started working together as faith leaders maybe in 2001, if my memory catch me right. So from there, we have been working together. I remember the first meeting between governments was held in February 2001 at Capital Hotel. So when NAC was not even formed. So government had already observed that the need for faith leaders to take part or to take a significant role in the fight against HIV/AIDS was paramount in this country. So we have been working together, and we have also been working in several consortia together with the EAM, ECM, so Malawi Council of Churches, on a number of projects, not only on this one. So this program only added value, and we went further by looking at what other areas the religious leaders can do apart from just preaching. So in this project, what we found as a multiplier effect was the fact that the imams and sheikhs were able to distribute the HIV test kits, which was not there before. From the Muslim community was maybe it was a new thing to see their religious leaders going on the front on that issue. So in terms of faith-based organizations working together, I think in Malawi it has not been a problem. So we haven't had any problem with that. And I remember previously on other projects, we have come together, defined our doctrines, and each one of us developing various policies, different issues such as SRH or family planning issues, using our own doctrine, but within the faith community. So there was no problem. What I can see, it was only the consortium only had an added advantage where each one of us could learn what the other motherboard is doing. Thank you.
I think just as an to add on what Jamba said, in our working together, what we've defined is that we are fighting a common for a common cause, but also a common problem. So we may differ in other doctrines, faith doctrines, but the problems, the social problems, including HIV and AIDS that is with us, has no faith boundaries. And because we discussed and agreed common approaches to ensure that we are addressing and dealing with the common problem, it was very easy for the faith-based organizations, the policymakers, and also the managers and technical teams to be working together. And let me just mention that there are other, even in the FCI, we had to share districts, but in each district, each mother body was accommodating every member of the other religious bodies. So for example, when we have a district where EAM is implementing the FCI, all members and all targets were from the various mother groups, religious mother groups that were taking place and participating in this project. So really fighting the common problem for the common cause is one of the factors really that united us together to ensure that we are saving the nation, we are saving the population, and we are helping government to ensure that the epidemic will be a history one day.
Great, thank you both. So the next question, I think, is for any of the panelists who would like to respond to it. The question is, could you speak more about how you've navigated the COVID-19 pandemic over the past years through FCI? We saw in the video that there have been radio and TV programs, but have there been other challenges to the work, and what solutions have you found to work around it?
I think I will start, and maybe NAC will add on. I think we followed the government guidelines on responding to COVID epidemic, and we also followed what the NAC within these guidelines had put down. And I think one of the things that I remember is ensuring that we are reaching to people that are already in treatment with the drugs, but rescheduling their time of coming to the health centers or wherever place where they are coming to correct their treatment. As a religious leaders, one of our biggest responsibility is to ensure that the population is knowing what they should be doing in accessing the HIV/AIDS services, including treatment, and where NAC and district management has been allocated places where people were to go and systems to be followed in order to access the treatment. So during the meetings and the other gatherings, we are so cautious, and we made sure that we are following the prevention and preventive guidelines that government had instituted. But most of all, to ensure that the people are knowing what are the systems and the procedures for accessing HIV and AIDS services, including treatment. So those, I think that's one of the areas that as religious bodies were able to do during the COVID-19. But I want to agree, it interrupted some of the procedures for reaching out to people with HIV sepsis.
Allow me to come in. So government issued instructions and guidelines on how to access HIV services, and of which at the beginning, counseling and testing was handled more of an elective, and HIV testing was, and as a result, it wasn't on the high priority. And then there was also, we went on to adapt in terms of how we disperse the medication. Instead of people getting their monthly supplies, they got multiple month supplies in order to streamline the traffic that went through the facilities. So in that particular, from the biomedical end, that's what happened. But from the community end, as you can see, this particular project really required that there was a lot of interaction with the community. And at the beginning, there was, it was a sudden epidemic. We were all feeling our way in the darkness and really figuring out. So there was actually indeed a time when we stopped everything. And then when guidelines came out, we started adapting and creeping back into provide services, of which some of the things that included were that there were some donations that were given to churches to make sure that they have hand washing stations. And FCI and USID made sure that there were enough provisions to make sure that anywhere where a project activity is happening, all the standards of prevention and that were issued were adhered to. So people were social distancing, people were washing hands, and were wearing masks. So those were strictly adhered to. And it went on to whatever things that were shared in terms of hand washing facilities, and they ended up being used by the congregations that we worked with. So COVID stalled us in the beginning. It affected our absorption. We went back in and did, there was an accelerated plan, and we're able to catch up. So, and I think HP Plus would be able to give that a little bit more because they were the direct overseer of the program. But on the government end, we saw a bit of hiccup. But also one thing we know is that we were able to bring people back into care, but there were other side effects of pulling out services because of COVID, which we're still reeling from, of which we saw astronomical high teen pregnancy rates and various other things that maybe in a normal lifestyle, they're not as much as we experienced because of COVID. So suffice to say, by the end of the project, we had caught up, we had delivered on all our deliverables despite and made adjustments to find a way of living with COVID, because it doesn't look like it's going to leave us anytime soon. Thank you very much.
Thank you both. Let me move on to the next question. again, for any of the panelists who would like to respond. So how has the program encouraged adolescent boys and young men to access health and HIV services, given resistance among that age group? Over and above the role played by the religious sector, what mechanisms are put in place to encourage younger men to access services? Dr. Saiti, would you like to respond first?
Yes. What we noted was that because the project really targeted two key social groups, men and young boys, or men and boys. So there was also huge or overwhelming participation of these boys into the program. The only challenge was that they thought we are going to develop different HIV/AIDS messages of hope only for the boys. But then, since issues were cutting across, I think they understood. And this is why, for us, it's when we designed those two activities, the Zikri competition and the football bonanza. So it made young boys. And through the participation in these areas, they were able to voice out the challenges, and they were also able to participate. I remember when we had the first Zikiri competition, the number of boys who came and who later asked, but there's Zikiri here, but we are seeing the doctors. So when the master of ceremony explained, there was people going for the test kits and the real VCT on the spot. So they were able to say, I think this program has exposed us to community issues rather than like somebody is forcing you to go to the hospital, to go to the clinic for accessing HIV services. So we saw that they were able, and also some of them, I remember it should be in Machinga and the Jalas, where we saw young people partnering with young organizations, like young people's organizations. For example, in Jalasi, I saw the young Muslims partnering with an already existing group in Jalasi, like the Namwela AIDS Coordinating Committee, where they were able to integrate the messages into drama and other, so then brought them together and speaking about their issues, adolescent issues. I think I saw, I heard in that activity issues to do with HIV/AIDS, early pregnancies. So they were able to speak out and present them to the religious leaders and the local government officials whom we invited at those activities. Thank you.
I think the other part that also contributed well in reaching out to men and boys is that we targeted the main groups. So in each of the religious worshiping centers, whether mosque or the church, there are main guilds where men only come together and discuss the spiritual things. They have spiritual programs just together as men. And this program, we deliberately targeted those as one of the places where we were able to find men only. I think in the video there was the games that men only play, and because these were our target, the men and boys. One of the things that we did in this project was to target places where we were able to meet boys and men only, and the men groups and boys in the community and in the church and mosques were some of the sports that were able to reach out to the boys and to the men. Of course, in the beginning, it sounded segregating the women, But it was really, the reasons were really shared and explained, and in the end, everybody understood the need for this program and this project to targeting men and go where men were to be found.
Thank you. The next question, again, for anyone who wants to respond, is, have you examined the costs of faith-based social and behavior change programs and how it compares to other forms to social and behavior change? I don't know if there's something that anybody has a response to.
Can you ask again?
Yeah, the question is whether anybody has compared how much it costs to implement a program that's changing social norms and behavior as we did through the faith sector versus other approaches to social and behavior change. And is it, I guess the question is it more expensive? Is it less expensive? Looking at it from that angle.
I think I'll just start to say that the implementation of projects and like these projects within the faith-based communities is cheaper, but that's not the warrant to using the faith-based community. But it is, we observed that even the behavior change and the response is cheaper in the sense that we already have an already existing audience. So there's a little cost in mobilizing the audience because we already have that. And we already have structures that we are able to go and find the targets, our target groups that are benefiting from the design, the projects. But I think most of all, as one of the persons mentioned in the video, the fact that it is the religious leaders that are promoting and causing the social behavior change, it sounded to be easier to follow that, unlike if it were like other maybe staff from the hospital where people will be saying, no, they are paid for that. Or maybe other organizations where they would interpret it differently. But the fact that they are sounding, the sound is coming from religious leaders. It is a bit easier for the audience and congregants to take it and follow as compared if it were other people. But certainly, one of the major contributor is that we already have the mobilized audience and we already have mobilized the structures, which reduces the source, the cost, if it are not other groups. So those are some of the, I think, areas that make the cost cheaper. But as I said, not based on that, we use faith-based because they are cheaper. But that's one of the advantages from using religious leaders.
Can I come in?
Can I come in on that?
Go ahead, Stalin.
Yeah. Okay, so I think the question of seeing if it is cheap or not, I think there has to be some science, so that's the big economics in it to do the proper calculation to compare the other approach and the other approach. But what we know is that this approach is able to produce results. And I think the other part is that, social behavior change is quite sometimes difficult to assess if it has really happened. But we, so far with the indicators that have been seen going high, we would think that indeed there's been an impact. But in terms of if the same amount of money, if it was used elsewhere, it would have was used in a different approach, if it was going to bring more results, it may not be as straightforward question as it is. We might need to do a proper assessment with all scientific parameters there. But the good thing at the moment we say is that we have seen the improvement compared to the conventional approach. We've seen that we've there's been that change if we were to compare with the conventional approach where we're just doing it routinely. So in other words, I'm saying we are able to see results in this approach. Yeah, thank you.
Let me just add on to that. The government, every year, we do a NASA report, and the NASA is the national investment kind of report, where we look at how much has been invested in the national response to HIV, from which sector and to what effect. And I'll be looking forward to seeing the NASA, now that this project is over, what it's going to say about this particular investment and the returns that come from that. So I'm saying all this to sort of really expand on what Dr. Zinkanda said regarding a scientific approach looking at an investment case. But I, in agreeing with what Mr. Jambo said regarding that it's a much more economic investment, I would almost say that it's a multiple return kind of investment. In that, here's what I've learned in my years on earth, I don't know doing this job. The power of religion on people anywhere in the world, not just in Malawi, anywhere in the world, is that you could be a PhD, but the power that your leader can have on you can undo all the science you may know. You could meet a person, talk to them at a medical setting, tell them on medication, of the mosque or whatever it is, and somebody they can totally undo your work. This can happen to the educated all the way to the uneducated. So to invest in the faith sector, to make sure that the faith leaders understand the right science around this disease intervention, it's a gift that will keep on giving back to us, because it will strengthen and it won't undo all the work we're doing in the hospitals. So I think I need also to emphasize that point, that much as we're looking at just the tangible investment, but it's the fact that the person who has a lot of power in people's lives has the right information, and that will help us many times over. Thank you.
Tione, I love that statement, a gift that will keep giving back to us. I think that is a good point on which to, unfortunately, close our Q&A due to time. I know we could talk a lot more about this exciting work that we are all so passionate about. So thank you so much to all of our panelists for your thoughtful answers to these questions. I'm going to invite our Malawi Country Director, Alvin Tema, to provide some closing remarks for today.
Thanks, Ashley. And I thank our panelists today for their time and for the good job that they have done on the ground. This project has been a success. And I know that for this project to be a success, it has really been the strong collaboration that was built among the religious leaders themselves. You have seen that the Christians and Muslims are working together for a common goal, but also the collaboration with the Ministry of Health, the National AIDS Commission, and also clinical partners on the ground, because these religious leaders were creating demand and linking the clients to the nearby health centers. So that was really a great job. So we are happy as HP Plus. We closed this project in September 2021, but we are seeing that because of the strong collaboration and the structures that have been built on the ground, the religious leaders are continuing. You know, the messages of hope will remain in the church, will remain in the mosque, because as they said, they don't have to ask people to come to church or the mosque. They already have the audience. So sustainability is really something that we know that it will sustain beyond the project. And we can only thank HP Plus team for the technical support to the religious leaders to build their capacity, and also for the strong collaboration with government. And we thank Government of Malawi and National AIDS Commission for the collaboration and the technical guidance. We thank USAID for the financial support to enable us to do this important work. And we thank our audience for taking time to join us today. Please take time to visit our website on HP Plus to learn more about this week and other work that we do. I thank you all. Have a great day. Over to you, Ashley. Thanks.
Thank you, Olive. And thank you once again to all of our panelists and presenters for being with us today. We appreciate your work on FCI and taking time to talk with all of our audience members. I hope everyone has a really excellent rest of their day.
Thanks, everyone.
Thank you.
Bye.
Bye-bye.
Bye-bye. Thank you very much.
Thank you.